breast cancer by far and large is a disease of females. There are men that do get breast cancer. However, that's a lot rarer than what we typically see. Typically, females over the age of 40 are our highest risk group for breast cancer. And that's, again, why self-examination is quite important, because most breast cancers are first detected through self-examination. And the person then finds a lump, which they're worried about, and present with a lump to their healthcare practitioner, which then initiates the cascade of events that leads to a diagnosis of breast cancer. So it is important that people do take cognizance of the fact that they might be at risk of breast cancer, particularly if they have a family member that suffered from breast cancer. To do self-examination is very important. So I'm going to be teaching you how to do a breast examination for yourself today. What you'll need to do the breast examination is a mirror and a pillow when you're at home. So what you're going to do, the first thing is, once you've gotten out of the shower and when you're prepared, I want you to stand in front of the mirror up straight, and I want you to look at the mirror and look at your breasts to make sure that the two breasts are more or less symmetrical, that you haven't noticed any changes in the breasts over the last while, that one breast doesn't appear different to the other, and that your nipples look more or less the same and in the same line, that there's no retraction of the nipple of one of the breasts, and that there's no obvious changes in the skin on the top of the breasts. Once you're satisfied that everything looks normal, then you can continue into examining your breast. So the best way is to put your hand behind your head, and then using your other hand, you're going to start all the way up at your armpit, and you're going to have a nice feel in a circular motion for any lumps or bumps that might be over there. Then we're going to move inwards toward the nipple, and I want you to give the nipple a nice squeeze to make sure that there's nothing that comes out, that there's no abnormal discharge from the nipple, and that you feel the texture of both of the nipples and make sure that the texture of your nipples then feels the same. Then I want you to move out in a clockwise direction and give a nice deep feel in that tissue surrounding the nipple. Once you've moved out all the way to the edge, give a nice up and down examination all the way around the breast tissue in a clockwise motion. And then once you're done, you'll move on to the other side and do the same thing. If you feel any lumps or bumps, it's important to write down where you felt it, how big you think it is more or less, if it's painful or not painful, and if you feel like it's nice and smooth, round or regular, or whether it feels like it has different edges. And then if the skin on top is different or if it's the same. Early detection of breast cancer is very, very important. The earlier we catch the breast cancer, the more likely it is that we get a complete resolution of the cancer, or a complete remission of the cancer. In cases where lumps are small and where breast cancers are unlikely to be very aggressive or have spread or haven't spread, then it is possible to do a lumpectomy where just the cancerous area is removed. Those are usually accompanied by surgeries that attempt to trace whether or not the cancer may have spread to a nearby lymph node. And a lymph node is also often biopsied or would be taken out along with the lump to make sure that there aren't cancerous cells along the path of likely spread. If breast cancer has spread further, or the person is at risk genetically of having a more severe breast cancer, or of having a recurrence of the breast cancer, then oftentimes a mastectomy, which is a removal of the breast, is offered to the patient. Mastectomies can either be on a single side where the cancer is detected. They can be on both sides if cancer is detected in both breasts, or they can be done prophylactically, which means to prevent cancer from growing in the remaining breast tissue. Some people even elect, if they have very high risks in terms of family or genetic history, to have a mastectomy done before cancer is even detected. And this is typically done with people who carry copies of what's called the BRCA gene. Famous people such as Angelina Jolie have opted for these procedures to be preventative. However, if you are concerned about this is something that you can discuss with your healthcare provider. So the things that we can look for, the red flag signs that we generally worry about with regards to the presentation of breast cancer, is something called peau d'orange appearance, which is French for orange peel. So if your skin's texture on the surface, especially around the area of a lump, tends to start changing and takes on an orange peel appearance. The other thing is nipple retraction. So if the nipple that was previously pointing outwards suddenly starts to retract and becomes inverted, pointing inwards, that's also quite a significant danger sign for us sometimes. The other thing is an abnormal discharge from the nipple can be a sign, especially in later stages of cancer, it can be a sign. Then if there are lumps or swollen glands in the armpit, they can be a sign of lymph node spread. So it's important to also investigate under the armpit. The other thing is if the overlying skin starts to start appearing as if it's infected, or it starts looking as if it's necrotizing, which basically means dying. That's also quite a bad sign. It's something that you should have checked out immediately.
Three.